Hi friends, welcome to the channel The Nurse. Here we are discussing about NIMHANS Nursing Exam questions and answers with their rationales. This is our 10th part of video. So if you are not watched our previous video means you can go to our playlist and you can watch all the NIMHANS Nursing Officer Exam related videos. So we will go to the topic and before that if you are not subscribed to our channel please subscribe. So we will move to the topic. So here I have included mixed types of question. So it will be helpful for preparing exams because I have selected some different subjects. So you can go to the subject and if you have any doubt means you can go through it and you can clarify it. I just uh, in periphery only I have touched. So there are more questions related to the topics. Examples I have selected questions from pediatrics, nursing research, and microbiology, etc. and psychiatry also. So you can go to the topic in deeply and you can see more videos and also you can watch the respective subject wise questions from our channel itself. You can go to the uh, playlist, different subject playlist. So we will start the questions. This is our NIMHANS Nursing Exams Model Questions Part 10. First question. A 6-month-old infant presents with irritability, poor feeding, and temperature of 39 degrees Celsius. The most likely diagnosis is urinary tract infection, pneumonia, gastroenteritis, otitis media. Correct answer is pneumonia. So pneumonia is common in infants. It is common in infants. It is an infection of lungs that can cause a variety of symptoms including fever, cough, and difficulty breathing. Usually in infants it will show irritability. In difficulty breathing is there means they will show irritability. It is especially common in infants and young children. Second question. A 3-year-old child presents with vomiting and diarrhea after eating a noodles at a fast food restaurant. The most likely diagnosis is food poisoning, gastroenteritis, intussusception, appendicitis. So most probably diagnosis is food poisoning. Food poisoning is a common illness that can be caused by eating contaminated food. Symptoms of food poisoning include vomiting, diarrhea, and stomach cramps. That is abdominal pain. Fourth question. A 4-year-old child presents with a rash, fever, and joint pain. The most likely diagnosis is pneumonia, measles, mumps, scarlet fever. This is easy question. Correct answer is measles. So rash is the word needed to highlight here because in other options rash will not be there. So measles is a highly contagious viral infection that can cause fever, rash, cough, and runny nose. Sometimes it may cause joint pain also. It most common in children with age of 5 or below. Fifth question. A 6-year-old child presents with a swollen and painful lymph node in the neck. The most likely diagnosis is strep throat, mononucleosis, ear infection, tooth abscess. So it may be due to strep throat infection, streptococcus infections. Strep throat is an infection in the throat and tonsils. Strep throat is a bacterial infection of the throat that can cause fever, sore throat, and swollen lymph nodes. The bacteria caused by strep throat, that is group A, Streptococcus. So it is a bacterial infection that usually caused infection in tonsils. Because of that, the nearby neck lymph nodes will be enlarged. So it will lead to difficulty in swallowing and sore throat, fever also due to infection. Then sixth question, it is an easy question. The central nervous system consists of brain and spinal cord, brain and peripheral nervous system, spinal cord and peripheral nervous system, brain, spinal cord and peripheral nervous system. The options are a bit confusing, but if you know means you can easily answer here. Correct answer is central nervous system consists of brain and spinal cord. The central nervous system is the main control center of the body. It consists of the brain and spinal cord. The brain is located in the skull and the spinal cord is located inside the vertebral column. Seventh question. The part of the brain that controls movement is cerebrum, cerebellum, medulla oblongata, brainstem. Correct answer here, cerebellum. The cerebellum is located at the back of the brain and it is responsible for coordinating movements and balance. Cerebellum is responsible for coordinating movement and balance. And this question is from nursing research. A nurse is planning a research study to compare the effectiveness of two wound care dressings in preventive infection in post-surgical patients. What type of research is? Descriptive, experimental, correlational, case study. So here, this is an example of experimental research. So we will see each options here. Experimental research means it manipulates one variable. Here in example, that is type of wound dressing, to observe its effect on another variable. Another variable here, that is post-surgical infection rate. So that is why experimental research here, correct answer. Then descriptive research means it describes a phenomenon or situation without manipulating variables. Same time, correlational research examines the relationship between two variables without establishing cause and effect. Case study focuses on in-depth exploration of single individual or group, not comparing groups. So these are the techniques in research studies. So I have given a detailed video on research study techniques. So you can go and watch there. Otherwise, I will give you here I button. So you can click the I button and you can go to the video. The ninth question. A stroke occurs when there is a blockage in the blood supply to the brain. This can damage or kill brain cells. The most common cause of the stroke is atherosclerosis, hypertension, diabetes, high cholesterol. So correct answer is atherosclerosis. Stroke may occur due to blockage of the artery or due to bleeding. So in this question, it is mentioned a blockage in the blood supply. So that may be due to atherosclerosis. Atherosclerosis, that is narrowing of artery, is a condition in which plaque build up on the walls of the artery. So gradually the plaque build up on the walls of the artery, then it will block the blood supply or arterial blood supply. Then brain will not get its oxygen and nutrients and it will lead to damage to the brain tissue, that is known as stroke. This can narrow artery and reduce blood flow to the brain. So stroke and myocardial infarction is it is a similar disorder. In myocardial infarction, the blood supply to the heart it is blocking, and in the case of stroke, the blood supply to the brain is blocked. Either it is due to hemorrhage or due to atherosclerosis. Then 10th question, the part of the brain that controls the speech is Broca's area, Wernicke's area, temporal area, parietal area. The correct answer is Broca's area. Broca's area controls or produces speech. Broca's area is located in the frontal lobe of the brain. It is responsible for producing speech. Same time, another area, that is Wernicke's area, that is located in the posterior temporal lobe of the brain, and it is responsible for language comprehension. Broca's area just helps to produce the speech, but the comprehension, the correct way of speech, that is known as language comprehension, like grammatical correctness and all, it is controlled by Wernicke's area. It is located at temporal lobe, Broca's area located at frontal lobe. These are the repeated questions coming in NIMHANS exams, Broca's area and Wernicke's area. Don't forget it. Then 11th question, the best way to collect a blood sample for culture and sensitivity testing. Using a venipuncture needle to draw blood from vein. Using a capillary puncture needle to draw a blood from a fingertip. Using a lancet to prick the skin on the earlobe and collect blood in a micro container tube. Using a nasopharyngeal swab to collect mucus from the back of the throat. So here the nurse or the person is going to do blood culture sampling. So for that, the nurse or that person has to use a venipuncture needle to draw blood from vein. A venipuncture needle is the best way to collect a blood sample for a culture and sensitivity testing because it allows for the collection of a large enough volume of blood to perform the test. Usually, blood culture sampling will be a sterile technique, and you need to practice a sterile technique to collect blood sampling for blood culture. And you need to collect two different area, the blood sampling from two different area. And then compare with the sample, and the microbiologist will get a report and which uh, organism causing sepsis. The 12th question, the best way to transport a stool sample for ova and parasite testing is. So here the highlighted words, the sample for ova and parasite testing. Options are in a clean, dry container, in a container with formalin, in a container with saline, in a container with transport medium. Here it is asked best way. So best way here, that is in a container with a transport medium. Usually we used to collect stool sample in a dry sterile container, but for if it is asked for best way, then a container with a transport medium will be the correct answer. Why it is used for the transport medium means it is a special type of liquid that helps to preserve the stool sample and prevent the parasite from dying before they can be identified. So if the transporter medium is not there means there is a chance to die the parasite. So the microbiologist is not able to find out. So that is why the transporter medium is needed to transport the stool sampling for parasites or ova. Then 13th question, a 28-year-old woman present with irregular periods and pelvic pain. On ultrasound, multiple small fluid-filled sacs are seen in the ovaries. What is the most likely diagnosis? Polycystic ovary syndrome, endometriosis, pelvic inflammatory disease, ovarian cancer. So this question is from Gynecology. So here correct answer is polycystic ovarian syndrome or polycystic ovary syndrome. Polycystic ovary syndrome or PCOS. It is a common in a woman nowadays. So it is the most common cause of multiple ovarian cysts and irregular periods in women of reproductive age. Polycystic ovary syndrome is the most common cause of multiple ovarian cysts and irregular periods in women of reproductive age. Endometriosis typically presents with deep pelvic pain and can involve ovarian cyst. But the pattern of multiple small cysts is less common in endometriosis. Endometrial ovarian cyst may occur, but it will not be multiple type of ovarian cyst seen in polycystic ovarian syndrome. But it can be seen, ovarian cyst can be seen in endometriosis also. Same time, pelvic inflammatory disease usually causes inflammation and scarring in the fallopian tubes and ovaries. It will not cause multiple cysts. Pelvic inflammatory disease, the multiple cysts will not be seen. Then ovarian cancer, fourth option. It is more common in older women because in question it is asked in reproductive age women, but ovarian cancer occurs in older aged women and often presents with different symptoms like bloating, weight loss and abdominal pains that usually seen in ovarian cancer. Then 14th question, the best way to transport a tissue sample for biopsy is in a clean dry container, in a container with formalin, in a container with saline, in a container with sterile saline. So for a tissue sample transportation, we need a container with formalin. Why? So formalin is a preservative that helps to keep the tissue sample fresh and intact until it can be examined by a pathologist. So that is the use of formalin. It is act like preservative and it helps to keep the tissue sample fresh and intact until it can be examined by a pathologist. Then 15th question, the best way to transport a swab sample for viral culture is. So you can think about our COVID period time. So how to transport the swab? So options are in a clean dry container, in a container with viral transport medium or VTM, in a container with saline, or in a container with refrigerated viral transport medium. So here the best way, that is in a container with refrigerated viral transport medium. So option B and D are similar, but in the case of option D, it is a best way because the viral transport medium is refrigerated. It will keep the virus parts in viable. Refrigerated viral transport medium or VTM helps to preserve the virus and prevent it from drying before it can be cultured. So that is the use of refrigerated viral transport medium. Then 16th question. A 35-year-old woman wants to start a family but has been diagnosed with endometriosis. Which treatment option would prioritize fertility preservation? Options are laparoscopic surgery for excision of endometriosis, gonadotropin releasing hormone agonist, hormonal birth control pills, hysterectomy. So all the four options can be used in the case of endometriosis. But in question, which treatment option would prioritize fertility preservation? The person's fertility should be preserved. So here best option is laparoscopic surgery for excision of endometriosis. Here only the endometriosis part will remove and it will preserve the other uh, uh, uterus and ovary for fertilization. So we will see how it affects. Laparoscopy can remove endometriosis tissue while minimizing damage to healthy ovarian tissue. Same time, gonadotropin releasing hormone agonists suppress ovulation and can shrink endometriosis lesion, but they can also cause temporary infertility. So it will not preserve the fertilization ability. Temporarily, the person will go to infertility. Same time, birth control pills also, it can also use to manage endometriosis symptoms, but do not directly address fertility concerns. In similar way, hysterectomy removes the uterus and ovaries, effectively eliminating endometriosis, but also permanently ending fertility chance. So, laparoscopical removal of endometriosis tissue is best way to preserve the ability to fertilization. So, we will move to the last question of this video. When conducting research, nurses should protect the right of participants. Which ethical principle emphasizes informed consent? Beneficence, justice, respect for autonomy, fidelity. The correct answer here, respect for autonomy. So what is respect for autonomy? Respect for autonomy requires informing participants about the study and obtaining their freely given consent. So what is beneficence? Beneficence means it prioritizes maximizing benefits and minimizing harm to the participants. Then justice. Justice ensures fair selection of participants and equitable distribution of benefits. Then last one, fidelity. It emphasizes remaining loyal to research objectives and maintaining confidentiality. So don't confuse respect for autonomy that mainly deals about consent. Beneficence means maximum benefit for the participants. Justice means equitable distribution, fair selection and equitable distribution. Fidelity means it maintains confidentiality and remain loyal to research objectives. So that is about today's video. So thank you for watching this video. If you have any doubt means you can ask in comment sections. So best wishes and don't forget to attend the maximum questions. Not from my channel only. You can watch the subject wise questions maximum, or you can read the books before attending NIMHANS Nursing Officer Exams, because it may come from any subjects, nursing subjects, and general subjects will be very less questions only. Minimum 5 to 7 questions may expect from general topics. Otherwise, you will get maximum number of questions from your nursing subjects only. And also one more important point is you may get questions from NIBH related questions, because NIMHANS being a NIBH hospital, you may expect questions from NIBH related topic also. And documentation, reporting, these and all related NIBH questions you can expect, but I cannot predict exactly. But please go some NIBH related questions also for your preparations. Otherwise, I will try to make a some video or one part of video exclusively for NIBH related questions. So that is about today's video. So thank you for watching this video. Please like and share this video with your friends, and don't forget to subscribe my channel, The Nurse. So thank you.